Thank you everyone again for joining us. My name is Taylor Ward and I use she, her pronouns, and I am the Community Engagement Coordinator with Just Solutions Collective. The Just Solutions Collective identifies and promotes just solutions to climate change from Black, Latinx, Asian, Indigenous, and frontline diasporas, and provides informed analysis, reports, and more on the just solutions for the climate crisis that supports the replication of community-developed, equitable, and just solutions policies and projects. Thank you all for joining us for the Let's Talk Mapping webinar, which we're hosting in collaboration with Front and Centered. This webinar will provide an overview of the process to create Washington State's Environmental Health Disparities Map, the role that map played in the HEAL Act, and how that map is being used in the fight for transportation justice. Today we will hear from Esther Min, the Director of Environmental Health Research Partnerships at Front and Center, Paulo Nunes-Ueno, the Transportation Land Use Policy Lead at Front and Center, and Guillermo Rogel Jr., the Legislative Advocate at Front and Centered. At the end of their presentations, we'll have time for questions and answers, so feel free to leave any questions you have in the Q&A box. And with that, I will pass it over to Esther to get us started.
Thanks, Taylor. Hi, everybody. Esther here, she, her pronouns. And so I will start off by introducing Front and Center, which many of you know already as a coalition of communities of color-led groups, primarily in Washington State, with diverse missions and work, but coming together to really advance climate and environmental justice. Let me make sure I share my screen, or try to share my screen while I talk. And so for us, our work spans across various different policy priorities, energy equity, equitable governance, and thinking about transportation justice along with pollution prevention. Can everybody see my screen? Okay, thank you. So thinking about the just transition and how we can accelerate it and be a part of it and push others to go towards it. One of the tools that we came up with was the Washington Environmental Health Disparities Map. And when I say we, there are many of us that I'll go over, but this is similar to those that know CalEnviroScreen, where it's a relative ranking map where we're comparing communities so that we can highlight those that are disproportionately or more impacted than some of the other communities around the different disparities, around the environmental risks, around the vulnerabilities, so that it can direct priorities, decision-making, resources, etc. And so I just wanted to go kind of step by step to really talk to you about our process, which takes its own unique form compared to, I think, some of the other agencies or agency-led efforts or smaller efforts that have right now become so many different EJ maps across the nation. So for us here in late 2016, Front and Center did outreach and looked for many different partners outside of Front and Center, because prior to this, Front and Center identified as a need for, hey, these mapping tools might be effective to just communicate and put in some plain, easy to visualize a way to tell decision makers and others, this is why our community needs more resources and why we need to target the reasons for these disparities happening or the sources of these causes. And so in late 2016, brought together University of Washington as a partner, and Puget Sound Clean Air Agency, which was a regional regulatory agency that had experience doing these mapping for their smaller jurisdiction, and for Front and Center wanting a statewide map. Department of Health, particularly the Environmental Public Health Tracking Network program called the Washington Tracking Network, because they actually already had a platform that was a mapping platform where if you upload the data, input a formula, it can spit out the visualization for you. So that infrastructure was there, which then would make this easier and lower cost because we didn't have dedicated funding for it. And then Department of Ecology for State of Washington, which houses our environmental data. And so during this late 2016, very beginning of 2017, we all met, a hybrid approach even then, because everybody was everywhere, aligning our goals and why are we even coming together? What is the purpose of this map that we're all trying to get? Because if we all have different goals, this partnership may not succeed. So let's spend some time aligning our goals and expectations of each other, what everybody wants to do, because that's their agency or organization's strength. And so we really, thought about Creating a map that can visually communicate the cumulative impacts so that it can easily demonstrate. The second goal for this was so that we can set a baseline and track changes over time to see the changes of disparities and hopefully improvement and hopefully the elimination of disparities over time. And to really hone those goals at the beginning of 2017, we also spent time talking about, do we want to spend time fundraising, or do we want to spend time as we fundraise, try to fundraise, start doing the work, because the work we wanted to do needed to get done. And as so many of you know, if we focus on fundraising, there'll be a time delay before we can get started. And we kind of want it yesterday. And so everybody decided, you know what, we'll all figure out how to leverage our existing resources. We're going to try and fundraise, but we want to, keep this going. And so we set out expectations of each other and timeline. We were meeting monthly. And so the first thing we actually did was we started by listening sessions because we felt like as a collective, listening to what community had to say about their healthy neighborhood and what they felt like were barriers to achieve that healthy or thriving community so that that can then be mapped, modeled, and data identified. This approach also allowed community to, I think freely and share freely rather than being bound by what's deemed, data that exists, quote unquote, or models that are possible now. And so that way, this can be kind of the baseline of what we want to model and achieve through the map, even if the data might not be ready yet. And so these were multicultural and multilingual conversations around pollution, climate change, sensitivity, and the resilience to really building up our communities to support the thriving communities that we want. And so this is just a snapshot where the stars are, and we've actually been building on these listening sessions from 2017 and onward, and really focusing on communities of color, households with lower incomes, immigrants and refugees, and linguistically isolated groups. So really groups that we know are really on the front lines and have been bearing a lot of the burden for the pollution burden that this country has been experiencing. And so after the listening sessions in the summer of 2017, then we went to, all right, this is what we heard from community. Water was critical for Pacific Northwest, also, everywhere, but really water had so much meaning to our communities, whether it was drinking water, recreational interaction with the water, surface water, or marine water. There was a lot there with air pollution, with resilience. So there's so many components there that we could start off of and then go and think about what are some frameworks that exist for us to model these? What are some data that might exist now or that needs to be collected? So, hey, agencies, you would need to start collecting this data. And so really opened up a nice conversation for about a year or so, trying to find the best way to launch something now, knowing that our end game is not this map, but it's going to be an ongoing map and ongoing conversation. And then through that, we looked into CalEnviroscreen and others and found that CalEnviroscreen's framework was really fitting for us because it brings together and layers the multiple pathways, the multiple harms with the multiple vulnerabilities. So we then put up a beta testing page, did webinars with especially going back to the community groups that hosted the listening sessions, and then spent a long time kind of honing the communication plan to make sure that we talk about this product as a partnership product, not just an individual organization leading and some following along, but we were all leading together. And then January of 2019, we had a big launch event. And so the framework, again, really relies on the California's tool, but thinking about cumulative impact. So, right, they all stack on each other, and that's why our communities are at the front lines of almost everything. And so thinking about threats, for example, fossil fuel pollution exposure around air pollution or proximity to heavy traffic roadways, or what's not written here and abbreviated, thinking about the degraded environment around you. So if you live near a Superfund site or a hazardous waste site, if there's an accident or something happens, right, flooding or whatnot, then your chance of getting exposed to these harms are going to be way higher than if you live 10 miles away. And so accounting for that degradation of the environment around you were also kind of what we put into this threat category. And then the vulnerability, thinking about who might be more vulnerable if this happens, if exposure happens, if air pollution is high. And so thinking about both biological vulnerability. So people that might have cardiovascular disease will have a worse experience, right? Worse health outcome if you're exposed to the same amount of air pollution, or people born with low birth weight, right? Even causing low birth weight, but also if you were born with low birth weight. So those would be the biological factors or biological susceptibility we modeled, but also the community level vulnerability. So the socioeconomic factors, the no high school diploma, limited English, people of color, population living in poverty. We are able to successfully keep our people of color indicator in the tool, which is different from, I think, some of the other states or even at the federal level. So I'll just point that out. And so we do the roll up like California does, and we have a single score that comes out that the Washington Department of Health then puts into these 10 buckets or deciles. I believe California does percentile, so you do get a little bit more refinement. So it's 1 to 100 versus for us here in Washington State, 1 to 10. 10 being most impacted and 1 being least impacted based on the data we have. And so, yeah, I will pass it over to Guillermo to talk about how we've used the map, and then I'll check the chat too for questions.
Great, thank you so much, Esther. So I'm going to go ahead and share my screen for everyone, but I am going to be referencing Senate Bill 5141, and I'll drop a link at the end if you actually want to take a look at the text, because the Environmental Health Disparities Map was developed, but it wasn't until the HEAL Act that it was actually enshrined into statute of how it was going to be used. And that was a part of the HEAL Act, which I'll cover right here in a sec, just so you have an overview of that piece of legislation that Front and Center helped lead on last year. Great. So for us, it's really where you live and your income, your language ability shouldn't determine how healthy and safe you are. But we know for a lot of our communities, that's true. Your zip code, your race, and language ability do have an effect on where you're able to live and how much pollution you are actually exposed to in your community. So we saw this as a problem and really looked to the Health and the HEAL Act, the Healthy Environment for All Act, to really help enshrine some protections for our communities. So the way that we did that was a few things. One, we wanted to make sure that everyone was operating off of the same definition of environmental justice. Environmental justice wasn't defined in statute. There were a few agencies, really one, which was Department of Ecology, that was leading on environmental justice efforts. So now we were actually able to set a baseline for what the definition was in Washington State. The second thing was that we actually wanted to incorporate environmental justice into the decision-making process, because for us, going to a just transition and following environmental justice means co-governance, and that means that community is actively involved in the decision-making process. So the Environmental Health Disparities Map was a really good example of that, because that was something that community members, along with agencies and then legislators, participated in to actually develop something that was a common tool that communities and legislators themselves could use. We also created an Environmental Justice Council. This is a community-led council that is going to be providing recommendations to state agencies on their agency request legislation and their funding decisions, among other things. And the other thing was also creating a community engagement plan, so that community members were involved not just in the creation and the implementation of HEAL, but for years to come, actively being involved in how agencies are conducting their work. And here's the definition that Washington State is using for environmental justice. So it reads, the fair treatment and meaningful involvement of all people, regardless of race, color, and national origin, or income, with respect to the development, implementation, and enforcement of environmental laws, regulations, and policies. This includes using an intersectional lens to address disproportionate environmental health impacts by prioritizing highly impacted populations, equitably distributing resources and benefits, and eliminating harm. So here are the agencies that are actually covered under the HEAL Act. So we have, for example, the Department of Health, Transportation, which Paulo will cover a little bit later, Department of Ecology, Department of Commerce, Natural Resources, Agriculture, along with 3 other agencies, which are the Attorney General's Office, Outdoor Recreation. The last one is I'm losing the last one, but there are 10 agencies who are under the HEAL Act. 3 of them opted in, 7 of them are actually mandated to follow what's in the HEAL Act. And at the same time, we also wanted to make sure that we built in tribal sovereignty and rights into the HEAL Act. So if you take a look at the legislation that we built, we had to make sure that the environmental justice itself, the council included 2 tribal members, and that they were considered throughout the bill. So the Environmental Health Disparities Map, how it's actually used in the HEAL Act. So one thing that's great about the way that the HEAL Act was created or drafted and funded was that there is more money going towards the Health Disparities Map to actually develop it and maintain it. So Department of Health was using the map, but now the Department of Ecology, Transportation, Agriculture, Natural Resources, and hopefully as that list of agencies grows, more agencies are using it, and that we could actually build it and invest more into the map. So as we as community members or as agencies need different data to actually track these health disparities, there is actually something in statute now that we could refer to now that the HEAL Act has passed. We also want to make sure that we're tracking changes over time. It's one thing to get an assessment of where we're at right now, but we want to make sure in 5 years, in 10 years, as Washington moves towards reducing its emissions, hopefully it meets its goals, that we are actually able to use the map to track those changes. The other one is document and a public summary of updates. So we want to make sure that this map is not just accessible for folks who know how to speak about different health disparities and exposure to pollution, but that the public could actually use this as a tool and can see very easily the changes over time and what's going on. And also it helps develop technical guidance and training for agencies and practitioners. This is, again, just making sure that agencies are actually using the tool and that they have proper guidance on how to apply it. So this is just from section 19 of Senate Bill 5141. I really encourage you, if you are into mapping and how policy is actually written about the map and how it's used, there's an entire section 19 in the HEAL Act that talks about the health disparities map, and I really encourage you all to take a look, because it's super important as we were lobbying for this bill and tracking all of the different amendments, that the spirit and the intent of environmental justice held throughout the bill, and that includes how the environmental health disparities map is actually used. And we know words matter in policy, especially. So one other way that the map is going to be used is for environmental justice assessments. So what we did under the HEAL Act was define significant agency action. These, and you can see the actual language to the left, but what we consider significant agency action are actions that may cause environmental harm or may affect the equitable distribution of environmental benefits to an overburdened community or a vulnerable population. We spent a lot of time in developing this policy and negotiating with stakeholders, businesses, legislators, different climate activists on this section specifically, because the Environmental Justice Council, the community-led group that I mentioned earlier, is actually going to be doing these assessments on all of these actions that you see as stars. And the map that Esther is mentioning, this is actually going to be used for doing those assessments. So if there's a specific project that's going on here, I think we're zoomed into Yakima here. If there's something going on, a project going on that's going to be affecting Yakima or different regions, or a statewide project that falls under significant agency action, they will be referring to the map as a way to assess, to do an environmental justice assessment, whether the project or funding decision or loan program, any kind of transportation project, that there is an assessment and that the community members are the ones leading on that, and whether or not it's a positive outcome, a negative outcome, and will it reduce health disparities? Will it actually increase health disparities? So that is one way that the map is going to be used. This is also really going to help our community members track it, track their increasing disparities or improvements. So it's a great tool to advocate. It serves as a reference for legislators. It's really great when we're able to hone in on one specific legislative district and look at different zip codes and areas that, why is one zip code in one legislative district so vastly different from another? And maybe that has a lot to do with the different pollution that folks are exposed to in their communities. There's also the HEAL Act and the Environmental Health Disparities Map really set a precedent for how community members and how data is used to inform climate legislation. So if that's the cap and trade program that just passed, or for example, the transportation package, we just want to make sure that the HEAL Act and the EHD are actually used. And it's also a benchmark for all agencies. So now we know the Department of Transportation, Health, and Ecology are working off the same definition. They're looking at the same map, and under significant agency action, they know what an environmental justice assessment will look like. And that's going to be a great benefit for community members and for agencies and lawmakers. So I'll leave it there, and I'll pass it off to Paulo, who will talk specifically about the map and health disparities and transportation in Washington.
Thanks, Guillermo. Can you give me a thumbs up that you can hear me? Oh, good. Hi, everybody. I'm going to share some slides here, and it'll be really brief. I think what I want to say overall is that we're building on this foundation that Esther talked about in terms of the Environmental Health Disparities Map, and also on the work that Guillermo talked about in terms of the HEAL Act. And these are huge achievements, and at the same time, I want to acknowledge the real limitations that we're encountering. For example, when it comes to transportation, we know that the enormous impacts of the highways and the pollution that highways make in terms of their impact on health with small particulate matter causing asthma and all of these negative health outcomes, let alone the greenhouse gas impacts of our roadway transportation. And the legislature in Washington state makes the lion's share of the decisions of what gets built. And conveniently for them, they didn't make themselves beholden to the HEAL Act. So all the great stuff that Guillermo mentioned in terms of the covered agencies and having to take seriously environmental justice that the HEAL Act causes agencies to do doesn't apply to the billions of dollars that are spent on building and expanding highways and creating more fossil fuel infrastructure that is the bulk of our greenhouse gas emissions and has a huge impact on people's health, particularly frontline communities that received those investments when they had very little power, or very purposely received, were the location of highways because they were redlined back in the day. So just starting with that note of caution that we still have to fight at a sort of very granular level to try to get environmental justice in our processes in Washington state. So what I'm going to talk to you about today is a tool that we are in the process of developing. So I'm really very explicitly calling this a work in progress, and we're really excited about it. And you'll see how it really rests on the foundation that Esther has laid with the Environmental Health Disparities Map, and leverages the work that the HEAL Act has put in place. So the Transit Justice Index tool. So a couple of things that we want to start off by saying is that transit is a powerful climate and equity tool that is largely going unused. And why is that? Our answer to that question at Front and Centered is because BIPOC voices have been sidelined in the conversation of climate and transportation planning. 60% of riders of transit are BIPOC and many are low income or disabled. And our voices have been easy to ignore because we have less political power. So how do we change that? And the recipe that we use at Front and Center that you'll recognize from these two discussions that we've just had with Guillermo and with Esther is, number one, to assert rights and really clearly say this, just like Guillermo said at the description of the HEAL Act, you know, people need to be treated with dignity and their environmental rights respected, regardless of race or ethnicity, income, or ability. We want to really clearly shed light on where these rights are being violated and then create advocacy and policy to demand justice. So this really is building on this work that the Environmental Health Disparity has set down in terms of shedding a light on where there are these very clear differences in terms of exposure to toxins, in terms of other vulnerabilities. And as it applies to transportation, the work that we've done at Front and Center with our partners and our allies and our member organizations is to develop a transportation bill of rights to then create an addendum in essence to the Environmental Health Disparities Map. That's this justice index, transit justice index that I'm going to tell you about in a bit. And then create a frequent accessible transit standard. So this number 3, we were able to get passed as a small, I think it was $250,000 budget proviso as part of the transportation package that Washington State just passed. But it causes the agency, our Washington State Department of Transportation, to start analyzing what would it take in order to create some equity across cities and across geographies in terms of access to frequent transit. So we've created a Transportation Bill of Rights, and the idea here is to be able to surface and to bring to light the things that everybody, regardless of whether they can drive or not, regardless of whether they can afford a car or not, should be able to expect from their transportation system. And it starts with very high level things, like you should expect not to die when you cross the road or when you go to school or when you're trying to get to a bus or when you're driving on the street. And it includes this idea of transit service that's frequent enough that you can get to work, that you can get to school, and you can come back. And that's really critical, and we'll talk about that in a minute. So the Transportation Bill of Rights has really caught on, and we've received lots of attention locally and nationally, and over 400 organizations have signed on to support it. And with the element that we're working on is to try to really bring into the discussion and to create the advocacy, to create the tools necessary for transit frequency and spans to be able to really increase freedom. So the question when we look at this equation is, well, who gets, and more importantly, who quote unquote deserves freedom? So what we look at when we start digging into this data in Washington State is that there is an enormous disparity between the city of Seattle and everywhere else in the state. What you see here is a bar graph of the percentage of the population that has access within a half mile, so a 10-minute walk, to frequent transit. in the 7 to 10 a.m., 7 to 10 p.m. I believe this is supposed to be 7 a.m. to 10 p.m. Yeah. So the idea that this chart shows is that people who live in Seattle, 88% are able to depend on transit that's frequent. And the second and third and fourth biggest cities in the state rank at 42% of the people, 33% of the people, and just 19% of the people who are able to count on frequent transit that can get them to work and bring them back, that can sustain a dignified level of access so that people can do the things that they need to do. So just to give you a sense for folks that aren't from Washington, where these places are, sort of arrayed across the state. And so what we're hoping that this mapping tool will do is we'll make these disparities visible. We'll amplify the voices of advocates on the ground who are able to say, why is it that we deserve so much less transit than other places in the state? And then support the policy development to make the idea come to reality. This is our timeline. So our approach to developing this tool is to adapt an existing tool by the Center for Neighborhood Technologies. And we're really looking forward to the partnership with them, which will be kicking off soon. And I want to close out by saying, why is this so important? Because it's so easy to ignore. When you or somebody in your family, somebody that you love was looking for an apartment or a house or place to live, did you have to ask yourself questions as you were looking at these places? Does this apartment have electricity? Is there running water there? Is there a toilet inside of the apartment or inside of the house? Are there roads? And clearly, we don't ask these questions anymore. And what we envision is a future where sidewalks and transit are as common as indoor toilets. So the first step towards making that vision a reality, we think, is showing where this incredible disparity, this violation of people's rights is happening. And we are really excited to get this going. So I guess I'll stop here and see if we have time for questions.
Wonderful. Thank you all for those great presentations. That was great. I learned so much. And so now we're going to switch over to our Q&A portion. If you have any questions, feel free to use the Q&A box to drop them in. Or if you like to speak, you can raise your hand and we can unmute you and you can share your thoughts that way. So yeah, we'll start with questions. One of the first questions was, how has the Environmental Health Disparities Map been used to target investments to priority/EJ communities? And have there been any pushbacks about certain regions not being represented, or any things like that have come up with the map?
Yeah, that's a good question. And I would say that the first one about targeting investments, that's beginning right now through the HEAL Act. So I don't know if it's really been put to the test because funding is kind of new in the environmental justice climate space as it relates to the map and HEAL. But that's something that we're looking forward to. And I think, there are different definitions going on right now, for example, about defining overburdened communities. And that is going to also help direct funding on top of how the analysis that the EHD does and other things. And then how politically has the EHD been received? Yeah, we got a little bit of pushback on it from some legislators. I think they were curious, how was it developed? How reliable is it? But it really gets put up to the test. There are 148 members in the legislature. Some of them are attorneys. Some of them are climate attorneys specifically. So, we have to be careful about how we craft language because it has to hold up. If there is a lawsuit that comes that is challenging the map, for example, the map is solid. As Esther detailed, there was a community public process. they work with state agencies, they work with practitioners. So it has to hold up, and I think it has so far. Esther, I don't know if there's anything else to add on that.
A common question that I think came up was, where's the peer-reviewed literature? And so that was the one time I heard that, you know, a lot of people just referencing it, because usually I say, like, I don't read it, like, who's going to read that? But I think a lot of people are just looking for a lot of documentation and just making sure what was the process, you know, who's vetted it. And so referencing California's and their history was really helpful in saying that, well, this has been vetted and tried and is it's still being implemented and used in a different state. We adapted it to our context, and we tried to do that with the data. I think for some of the programs, individual programs, even before HEAL Act happened, started to think about using this map for maybe not prioritizing grants like public participation grants, but definitely asking applicants to consider what your area is, use the map, and then perhaps if it had a lot of impact in a highly impacted area, potentially prioritizing those grants or whatnot. And so there have been a lot of, I think, smaller programs that started to do that, and now statewide, you know, more plans to do that as well. I think there was also kind of related to just data not representing or thinking about rural and urban divide. So one example is when we were in the process of it, developing it, very aware of this data, you know, sometimes incomplete, sometimes biased. So one example for the indicators that we added that's different from California is housing burden plus transportation expense. California tool has housing burden in it, but not transportation. And from our communities here and the practitioners here, they were saying, like, you need to have transportation expense as well, because we have some counties that are very rural and some areas that are very urban. And so there's a lot of gentrification and everything else. So you need to have both in there to be able to capture the communities that might be struggling with housing just because they're so close to a metropolitan area, but might not have as high of a cost for transportation, or for rural areas, lower housing, but really high transportation expenses. And so those were some things that we brought in. There was some sensitivity analyses done. And so for the different categories like air pollution and exposure, highlighting a lot of urbanized settings like, you know, air traffic related, roadway related air pollution, but also some of the proximity to or these degraded environments did pick up a lot of the rural area or less, you know, the suburban or the exurban areas and those concerns too, but continuing to be developed because obviously a tool, we want to make sure that it doesn't bias, you know, inherently because of the data we bring in towards one or the other. So there's constant conversation on that and room to, I think, continue to improve.
Wonderful. Thank you. That's great. And so for folks who are in states where like EJ focused maps just aren't in existence right now, what kind of resources or tools or any lessons learned would you point them to in the process of like developing those resources?
Such a great question. And we've been starting to get questions from folks across different areas that say, hey, you know, California, what they did is cool, but we don't have an agency that's at the forefront of saying, this is EJ, let's do that. And then having a lot of resources. And for Washington State, when we started out, we didn't. And so I think one of the things and the power that I think this Washington State process had was the community leading and the community directing and the community saying, we need this. State agencies, you are accountable to us. Use your resources to help develop this tool that will be useful for you. And if you can maintain it and own it, that'd be even better. And so just having that and really being clear about the needs and finding the right type of partner, like, so who might have a mapping platform that might need to be tweaked a little bit or might just need some data in there. And so finding those partners, I think Front and Center did a lot of work beforehand, leading up to the launch of this, and trying to find from technical partners perspective, you know, who might have experience or resources, or like a student or a student resource through a university who might have the little bit more time and energy, especially for a project that didn't have dedicated funding. And so really, I think tapping into the eagerness and the energy that is out there might take time and a lot of effort, and it might happen slower than I think what we wanted it to, but it can happen. In that patience, I think that everybody had in that work group, and I think we had like 98% of the people always show up to every single work group. And so we had staff from agencies to community members really dedicated to being there. And so I think finding those right people would be really critical to having success, even if it's harder to find dedicated funding.
Wonderful.
I think just to add on to that, states, and legislators are always looking towards other states who have done something, because they never really want to be the first ones to do it if it hasn't been tested. So I think it's also a good example, the structure of HEAL and how it directs and defines, things in the map. That's something I think can serve as a tool to advocate in different states too.
Wonderful. Yeah, that's definitely true. And speaking of that, one question I have for you, Guillermo, is if there are any lessons learned that you saw with the development of the HEAL Act that can help others in other states that are looking to develop similar policies, just any insights that you have that would be helpful.
Yeah, I think one is just that a bill like this is necessary to the same way we're doing the transportation proviso and setting a baseline standard for public transit. If folks are not on the same page about what environmental justice is and what it looks like and what are the existing health disparities, then everyone's operating under different assumptions. Their solutions to the climate crisis will be different, and there's also not a targeted approach. It's for us, part of this and part of other climate programs is directed funding, dedicated directed funding. We have a revenue source that will build investments into communities to reduce those health disparities. So I think one, it's necessary, but then it's also finding champions, because there are a lot of climate champions and environmental champions out there, but environmental justice and building in community into the decision-making process, that part is not necessarily part of all of everyone's climate agenda. Folks will want to reduce emissions in any way possible, but then if the solutions are not centering frontline communities, then you're just going to exacerbate already existing health disparities, income disparities, all of these things. So I think it's finding those environmental justice champions within the climate movement who will center our frontline BIPOC communities.
That's great. Thank you for that. And Paulo, a question for you. So oftentimes transportation conversations, as you mentioned, don't center people of color, don't center folks with disabilities. And a lot of times groups don't know where to fit in the conversation. So any insights that you have on how people can make sure that their voices are heard in transportation conversations, especially as we're starting to see more federal policy and funding around transportation, and just making sure that communities are able to get the resources that they need to address these issues?
What's really interesting is that in the bipartisan infrastructure bill that was passed, there's a lot of money, and the funding opportunities have incorporated the question of equity and environmental justice in a way that they haven't before. And so the US DOT, for example, has a mapping tool that tracks transportation disadvantaged communities, that there are questions about environmental justice and using the EPA environmental justice screen there. And I think what needs to happen is that frontline communities, BIPOC communities need to start to the process of identifying the projects that really help us, that are really our priorities, and then start to find the coalitions that can create those projects in concept, that can start getting a little bit of money to design sort of proof of concept. Because what happens is just like anything else, that the folks with privilege are always at the front of the line, right? Even if these ideas are being put into the funding processes, the work that we're doing is trying to sort of level the playing field. The fact is that there's all kinds of projects that are already quote unquote in line because they've received the money to do this idea of conceptual development. They've done some of the environmental vetting that needs to be done, so they get funded first. And so we really need to work really hard to create that backlog of projects and investments, even if they're just on paper, right? Even if it's just so that when the opportunity comes, we can take advantage of it. You know, a lot of times there are huge disparities in the processes in which things are funded that are a really bad liability in terms of environmental justice, in terms of racial equity. And we're hoping that folks can start to call those out. You know, so to be, you know, very concrete about that, you know, the infrastructure law has, I don't know, I'm gonna pull some, essentially it has 4 times as much money for highways than it does for transit or for rail. However, that 50% of the money that's there for transit can be flexed to other uses if people make their voices heard and if they're able to go and advocate for that at the state level. So I've been hearing the amazing work that BIPOC advocates across the country are doing in terms of transit justice, in terms of really making the connection between transportation investments and EJ. And this is the time to be doing that because there's actually a lot of money at stake. And, you know, not to be doom and gloom about this, if we don't have a hand in making sure those go towards reducing the harm, they're just going to do more harm. And they're going to perpetuate the kind of investments that have displaced communities, that have, you know, separated communities, that have created the environmental health disparities that Esther talks about. So the time is really now, Taylor, to do exactly what you're just saying, is make your voices heard in these tables where we often don't show up.
That was great. Thank you. Very, very helpful. And then another question that we have is, has there been any formalized outreach back out to community groups that originally provided input through the focus groups to kind of avoid the extractive practices that happen with, you know, reaching out to community and creating something?
Great question, and one that, you know, as a coalition, as the coordinating team, you know, we always take it very seriously and also bear that burden of being that kind of the in-between group. And so for any of the groups that, you know, we had engaged, you know, they were invited to, before the draft map was even finalized, making sure like, hey, this is a draft report. What do you think? This is what we summarized. Does this feel right to you? Did we miss something? Is there anything you want to add on to? And so we had that process for both before the first version even came out and about. And then throughout the advocacy for HEAL and for thinking about the other ways to use the map, the community groups that were involved, many of them were also involved in those advocacy themselves because they knew that it was their voices that were part of the whole mapping process and everything. And so that was elevated. And then when we go back and do events, we're doing, you know, we do series of listening sessions for each season or a couple times a year. And we go, hey, remember we were here 2017. You might not have been here, but like your friend might have been. And it's just connecting back to how some of the conversation we've had, how that even relates to the conversation we're having now and why we're back out there listening again. And so we do make a lot of effort to try to continue to connect the dots because we are building a movement together.
That's great. Thank you, Esther. And so to kind of wrap up the questions, it would be great if all of you, if you had some insights on what is something that you would want to leave folks with who are doing work in all of these different fields that you're in. So in mapping spaces, in environmental justice, in transportation, in policy, any just like last thoughts that you'd like to leave folks with, and we can just go down the line.
Paulo, you're off mute, so I figured you wanted to.
I was hoping somebody else was going to jump in. I guess, Taylor, what I'm really looking forward to is the opportunity to collaborate with folks on the call and to share, to hear where they're having successes, where they're having challenges. Yeah, I would really love for an opportunity for us to get together and have a open discussion about what folks are seeing in their work.
Yeah, and I think to add to that, somebody had commented about like a federal program developing these maps. So mapping is becoming a popular tool for some of this, and also knowing that, being very careful about, or at least I'm always careful about, is it the right place to have a map? Or does one already exist? Can we reference something else? Do we need one? Do we need this type of tool now, or the energy, or can that energy go elsewhere? And I think thinking about, our collective movement together in the just transition, and how so many of us like coming together becomes like 1 + 1 = like 10. And I think some folks get nervous about that when they're like, oh my gosh, there's this grouping and there's a movement. But I think, we collectively can really harness that power together to create the hopefully the change that we want to see.
Yeah, and I think the last thing I'd add is has to be room, I think, for everyone in the movement for if it's mapping, because mapping is about policy and creating a tool. But I think there has to be the policy advocacy, the grassroots mobilizing, the education, and then also time to celebrate, because all of that has to be in the mix. Like one can't exist without the other, because if you're developing policy without community, then it might be flawed. And if you're not making time to celebrate or be in community just as normal people, building relationships, then things can crumble even after the policy has been created. You need that active follow-up and members to be there.
Wonderful. Thank you all. That was great. So thanks to our presenters for being here, and thank you everyone for attending. I am going to drop our post-event survey in the chat. If you could fill that out, that would be great. Let us know if you'd like other spaces to continue these conversations, or if there are any topics that you'd like us to talk about in the future. I will follow up with some follow-up materials later this week, but thank you all for being here, and I hope you have a great rest of your day.
Thanks so much.
For everybody.